All righty. Good morning, Pagosa. It's a beautiful Friday morning, TGIF and all that. And glad you've joined us for Good Morning Pagosa. We are live at the Pagosa Springs Medical Center. And I'm visiting here with two guests. I have Dr. Bill Jordan, who's been on the radio before, and in Oncology and Hematology, Darcy Harper, the nurse practitioner in the department. Good morning, you guys.
Good morning, Will.
Thanks for having me over.
It's always a pleasure to be with you. It's been fun.
It's fun, right?
Yep. Why not?
Why not? Yeah. I think of your dad because he was on the radio, and I think that's just so cool.
Yeah.
So here you are.
I used to sit and listen to him when I was a little boy, announcing sporting events. So that was always fun.
That's
interesting.
So cool.
Yeah.
And Darcy, welcome to the radio show.
Yes, thank you for having me.
Yeah, of course. And do you want to do some introductions first?
Yeah.
What do you think?
Well, I know you and I have done this together for several years now. We're now in our 7th year now of our cancer center here. Our next anniversary is in February. It's gone by fast, wow. And we've had some ups and downs, and right now things are running so well. We're unfortunately seeing a lot of new cancer patients, but we're seeing patients from places we haven't seen before, way down south into New Mexico and out east, and sometimes all the way out to Alamosa. And we're seeing patients from the west too. So we have a full complement of staff and our new technology, which we can talk about, especially since this is Breast Cancer Awareness Month. We can talk about some of our new mammographic technology. And really an important addition we've had is Darcy Harper. Darcy's our new nurse practitioner, very experienced in oncology, with great training, great experience, and also in palliative and supportive care and other areas that relate to what we do here. And I think what I'll do, Will, is just be quiet a minute and let Darcy introduce herself and tell us about herself.
All right, Darcy.
All right, well, I'm Darcy, and I've been a nurse since 2004, initially working in Johns Hopkins in Baltimore in children's cancer and bone marrow transplant. Going on from there, went into hospice, which I did for 15 years as a nurse and a nurse practitioner. When I graduated with my master's from Georgetown University, decided that I wanted to stay in cancers as well as hospice. So I have years of experience in adult cancer and blood disorders, some experience in pulmonology, outpatient, and as well as the indigent clinic, uninsured clinic in primary care. I'm moving to Pagosa Springs with my family, just happened upon this wonderful center and am happy to join it.
Wow, that's a cool story. So you found Pagosa, or Pagosa found you, and here you are.
So
Yeah.
I was married in July, and my husband has been visiting Pagosa Springs for many, many years, every year for Father's Day.
Okay.
So, when we looked at what we want to do, both of us landed here. So
That's so cool. I was just thinking Johns Hopkins and Georgetown. Oh, there's this cute little yummy French restaurant. It's like a little cottage. I don't know if you... Anyway, that's an aside, but that's a nice town.
Going back to Baltimore soon, and I'm very excited for McGurk's cheesesteaks.
Okay, there you go.
I try to get back at least once a year to visit with old patients.
Nice.
So this time I'm going to get to visit with a girl that I treated 20 years ago for her childhood leukemia.
So you can see we're really happy to have Darcy, and why.
Right.
And she's been a great addition to what we're doing here. We're also next week interviewing 2 new oncologists that are very interested in coming here, one from Montana and one from Nebraska. And so that's going to be fun and interesting to see. They what's not to love about Pagosa Springs?
Yeah, really.
and so I think that's a testament to the cancer program here, and also a testament to the growth of the hospital and healthcare in our community as well.
And providing this, very wonderful service, so people don't have to drive too far initially or whatever,
Yep.
It's right here in our backyard. And as you mentioned, people, come from all around. I see a lot of New Mexico plates here.
Yeah.
And then from the east and the west. So good. Special place.
Yeah, it is. And sort of a support of that, we're having an open house in 4 days on Tuesday, the 29th. And it's an open house for oncology, for our cancer center, and it's for the community, and everybody's invited. We will have, it's from 5 to 7 next Tuesday, and we will have some entertainment. We will have food and drink and live music and a chance to have people ask questions and see what's on their mind, not only for oncology, but here at the medical center and also in healthcare in general. So it's a good time for the community to get out and support us like they always have. And I think, Will, in that same vein, I want you to know how much we appreciate your personal support and the support of KWUF over the years. It's been a lot. It's been quite meaningful for us. And I want to let you know that we all, from all of us here at Pagosa Springs Medical Center, we do appreciate that.
Of course. It's a very special place, and we've seen the growth and just an amazing change over the years. You wouldn't believe, Darcy, when we first moved here, I don't know, 6 years ago, there wasn't even a clinic, much less a hospital. So we started with barely a clinic, and then over the years, here we are. And now we have a cancer center. And you said, what's the anniversary again? What year?
7.
7 years. I remember that too.
We
did a little event here at the hospital, and you started that up, and
it's amazing how fast it's gone,
right?
And how much it's grown. And we've increased our level of sophistication in our decision-making tools and using our algorithm programs for our decision-making for treatment. And so it's basically for the customary types of malignancies that we see and blood disorders. It's not a matter of getting treatment that's the best in Pagosa Springs. It's a matter of getting treatment that's the best in the world. So we're able to use the information that we have worldwide and maintain the decision-making processes according to that really sophisticated information here.
What kind of new equipment and new features do you have, like, over the 7 years? What's new, and I don't know, any new technology and
over the last
procedure and all that?
Over the last several years, we've had it's called Via Oncology, which is a pathways process of decision making, which is, I think, invaluable. It's the same process that they use at all the major cancer centers around the country, and so we agreed 7 years ago to implement that, and it's been really valuable for us. Not only does it help us maintain the very best decisions in terms of treatment options, but it also helps track our decisions and gives us reports on how we're doing and how we compare with others. And that's always been a good thing. And we've developed some new sophisticated lab techniques. Dr. Jessica Cox joined us, 2 or 3 years ago. She's an interventional radiologist, so we don't have to do those special needle biopsies and things like that elsewhere. We can do them right here on site. We have Lori Medina joined Dr. Tingley in surgery a couple of years ago, so we're able to do most of the general surgical approaches in addition to some of the other approaches that we require. And in radiology, we've, as you know, we had a big fundraiser for that a few years ago, and because of community support, we were able to acquire a tomosynthesis mammogram, which is known as 3D mammography. And that gives us a much better idea of what we're seeing than regular 2D and other standard mammographic approaches. It also helps us, it prevents false negatives and false positives, so we're able to make better diagnoses. And And in addition to that, we have now MRI, breast MRI. And breast MRI is able to help us a lot with people who have had prior procedures involving their breasts that have some distortion of the architecture of the breast, and also in women who have dense breasts where standard mammography is difficult. So we've developed the ability to do diagnostics as well as therapeutics that has grown in accordance with the standard of care almost any place that we see, especially in community cancer centers.
And Dr. Bill, you mentioned it's Breast Cancer Awareness Month, so
Yep.
do you want to talk about that a little bit? So it's
Sure.
appropriate. Yeah, I mean, with the new 3D mammo and everything, so that's a wonderful thing.
It's been an interesting month because we've seen a lot of people come in for screening because the breast cancer awareness
So it works.
has made people aware.
PR works.
And we're trying to continue on that path. Just to let everyone know that there have been some changes regarding the recommendations by the U.S. Prevention Task Force and the American Cancer Society about when to start breast screening. Typically, the standard has been somewhere between the ages of 40 and 50. That's been the standard. And what we're seeing now, we're seeing younger women with breast cancer, and that's changed so that the recommendations now is that in women with average risk of breast cancer, that is, they don't have added risk, they recommend starting breast screening, including mammography, at the age of 40. And then annually after that. And that's in women with average risk. And women with high risk, and I can talk about what high risk
what
means.
would that be, I guess?
They
Family.
recommend starting at the age of 30. And high risk is defined primarily by multiple criteria. Darcy, help me if I forget something. It's women that have the breast cancer gene, the BRCA1 or BRCA2, themselves are in first-degree relative. It's in women who have...
First degree is like parents, grandparents?
It's like, first degree is like mother, father, sisters, brothers that carry the gene.
Okay.
Keep in mind, we think of the breast cancer gene as women, but keep in mind that men carry the gene too. And we're starting to see patients, especially with prostate cancer, men with prostate cancer and other cancers, where we look for that gene and find it. And when we find it, it gives us a new option for treatment in those types of diagnosis that we haven't had before. Also in women who we know that obesity increases the risk. We know that heavy alcohol increases the risk. We know that women who have been exposed to radiation therapy before the age of 30 increases the risk. We know that women who have never been pregnant have an increased risk, and women who started having menstruation at an early age have an increased risk. And also women with breast densities, who have a dense, thicker breast tissue, have increased risk. And people at higher risk, once again, the recommendation is that they start mammographic screening at the age of 30. People at average risk at 40. But the whole idea of waiting till your mid-40s or 50s or later to start that is not a good idea.
There's been a lot of talk lately about what is heavy alcohol. I don't know, or you know what I mean? What's reasonable?
I guess it depends on who you ask.
Who you ask. Right? Okay. Good answer. Thank you. So, well, good. Okay, so...
Did I leave anything out?
There's more than just the BRCA1 and 2 genes that increase your risk for breast cancer. So, not solely focusing on those, but, there's PALB2, check, and several others. And if you do have a first-degree relative with breast cancer, the recommendation is to start as early as, or, no later than 30, but 10 years prior to their diagnosis. So if they were diagnosed at 35, you should start at 25.
And that's just a good rule of thumb.
Okay, 10 years. So.
Yeah. We see familial clusters. We'll see young women with breast cancer or women with breast cancer that have familial clusters, a mother and a sister or mother and an aunt, that don't have genetic changes that we can find. And when we test for BRCA or some of the other genes, sometimes we'll find mutations of unknown significance. They're not normal, but they haven't been defined as being abnormal yet. Those are the ones we worry about because we don't know. Mm-hmm. And so we really encourage people that have familial clusters, especially in first-degree relatives, or a line of relatives with breast cancer or ovarian cancer.
Right. They seem to be related.
Yeah, to keep on top of that.
Yeah, my mom had ovarian. Her mom had breast cancer, and her sister had nothing, and she's still going strong.
Yep.
So I don't know. That gene is kind of elusive or mysterious, or I don't know. It seems like you're getting a handle on it, though. Like
we're getting a handle on it. It's getting better, and people are becoming much more aware of it and educated about it. But once again, keep in mind that the men carry the gene too. Mm-hmm. So if you see someone that turns up with a BRCA gene and their mother was negative, it could be carried by the father side of the family too. Mm-hmm. And so it's something to keep in mind. We don't think about that a lot. People think of breast cancer as a women's thing, but the BRCA, the genetic component of it is not, it doesn't discriminate.
How do you spell that? B gene, BRCA?
BRCA.
Oh, gotcha. Okay, it's like
it's just it's abbreviated like the breast cancer gene, BRCA1 and 2.
Okay.
And once again, it denotes a higher risk for breast cancer, ovarian cancer, colon cancer as well. Mm-hmm. And now we're seeing that some people with other gastrointestinal cancers have that genetic component, as well as other, as Darcy mentioned, a lot of genetic components. We know that all cancer starts with a mutation, or it wouldn't be cancer. The cell starts with a mutated cell, or it wouldn't be cancer. And so the question is to work backwards and find out how did that happen, where did it come from.
Mm-hmm. And of note, it's also very important to do your monthly self-breast exams. It doesn't negate having a mammogram. You need both of them for early detection. Early detection is key because, in early localized stages, we can actually, majority of the cancers, 99% of them, with breast cancer, we can cure. So early detection is very, very important, and self-reliance on knowing your own body.
Well, great. We're going to take a quick break and get back to our Pagosa Springs Medical Center Good Morning Pagosa show here in just a couple of minutes. And we'll be right back. Okay, we're back, and we're live at the Medical Center here this morning on this Friday, and we're speaking with Dr. Bill Jordan of the Center for Cancer and Blood Disorders, and Darcy Harper, Oncology nurse practitioner in the center, and it's great that you invited me here. I want to talk again about this open house next week, right? Tuesday. And you mentioned music. I see Robin Davis duo is going to be playing. That'll be fun. Mm-hmm. It's going to be out here in the lobby, or what do you think?
I think it's going to be in this side of the hospital, on the cancer center side of the hospital, what they tell me.
5 till 7 on Tuesday.
Yeah. Our full staff will be here. All of our cancer center staff will be here, ready to answer questions and address issues. And for the most part, we like to do this, and we do this periodically just to say thank you, because we get so much support from this community. It's really appreciated.
And it looks like a learning opportunity too, with interactive activities, educational activities. So mark that down, folks. It's just next week, Tuesday.
Yep.
Anything else you want to talk about? We've talked about breast Cancer Awareness Month and updates on the center. It's all just fantastic. We really appreciate what you guys do, and it's amazing. It really
I have one other thing that I'd just like to say while we have an audience. I see patients every day, and they ask me about new therapies. And, right now pharmaceutical industry is doing direct marketing to patients. You will see it on TV with cancer therapies and things like that. And so I have this conversation quite frequently, and I have the the good fortune for many years to be on what is called an institutional review board, an IRB. And an IRB is the last board that is required to approve a new drug before it can be used in humans. And so I've been doing that as a senior oncology scientist for a number of years. And so I have the good fortune of seeing what's available and what's coming before it ever gets to marketplace. So I want to encourage everyone that what's happening in oncology is actually quite exciting in terms of options for treatment, options for diagnosis, and options for cure.
A cure of cancer.
And that's important for everybody to know.
That's the goal, right?
Yep.
Yeah, that's important. IRB. That sounds interesting. Do you have to travel, or can you do that on Zoom?
No, it's done remotely, and I have it's every Monday. I work on that all week long, but it's every Monday for a Zoom call, and there are specialists from all over the country, both coasts and here, and you name it, that make presentations. So we get a chance to see, quite often I get a chance to see first-in-human studies. It's the first time the drug's ever been used in a human. And interestingly enough, we look at some of the drugs that we see on TV now. I had a chance to review those 10, 15 years ago as first-in-human drugs, and all of a sudden I look up and they're on TV. So
wow.
Some of them make it, and the ones that make it really make a big impact on how we manage cancer these days.
Now if we could just get those folks to advertise on the radio too. I wonder how much those ads cost, because they're long and detailed.
Yeah.
You know, the pharmaceutical ads.
It should be.
They're kind of, yeah, and there's a lot of disclaimer and this and that. And, I mean, some of it's experimental, or no, just once it gets to that stage, it sounds like it's past the experimental phase. And
they can't advertise for experimental therapies, but these are amazing drugs. Most of them have to do with immunotherapy, have to do with mutations, at least in oncology, but in other things, psoriasis and some of the other things we see advertised, monoclonal antibodies and interesting new things that are, for somebody that's been around as long as I have, it still gets me jazzed in the morning to think about that we have something new today.
Mm-hmm. It's progress. It really is. Remarkable progress. Fantastic. So thanks, Dr. Bill and Darcy. Good job. And once again, Tuesday is an open house at the Cancer Center, 5 till 7. So we'll see you here, and thanks for inviting me to the hospital. I encourage people to, just get started with primary care here. I mean, it's a really fantastic group. They have different groups, different color groups, right? Green, orange. I don't know what they are, but
the overall primary care here is as good as I've ever seen.
It's really good.
It really is very good. And once again, we appreciate you and all you do to support us. And
the clinic too. Yeah, you bet. Thank you. And the phone number here is 970-731-3700. Give them a call, and if you're new to town, get started at the hospital here. Just taking care of that. Your health. It's what we got.
Yep.
So thanks again, you guys. Darcy, great to meet you.
Nice to meet you.
All right, we'll see y'all later. Have a wonderful day and weekend. And thanks for tuning in to Good Morning Pagosa on the Wolf.